the new social health insurance fund will hit polygamous marriages hard, as they will be forced to pay more to sustain their families in the insurance scheme. Appearing before the Joint Parliamentary Committee on Health, the Health Ministry clashed with lawmakers over classifying of men with 2 wives or more as having 2 households, regardless of the number of dependents involved. Lawmakers want regulations adjusted to ensure polygamous marriages are subjected to the same kind of deduction criteria that their monogamous counterparts are subjected to. Here's Stephen Leto with that report.
A joint parliamentary committee on health bringing together the National Assembly and the Senate held their final meeting with the Ministry of Health over the new medical insurance scheme, SHIF. One of the issues that cropped up was the growing number of polygamous marriages in the country, who the new law will require to pay more to sustain families in the social health insurance scheme by government. MPs have termed the regulation discriminatory.
You are actually going against the marriage laws of Kenya, which permit polygamy. And for avoidance of doubt, Madam Pierce, I have only 1 wife, and we don't have a certificate.
The regulations and the Act has classified men with 2 wives as having 2 households and required to each pay for the deduction of 2.7% on gross pay as insurance. The lawmakers questioned why the regulations presented before them ignore the right to a polygamous marriage, yet it is allowed in the Constitution.
Sitting here, it's easy. When you get to the village, it's a different story. You tell us, under the Children's Act, there is customary recognition of guardianship. Again, provisions. So that we have clarity. If you have 2 wives, that you would actually be treated like 2 households. And I don't know how that would be, because we have defined it in the Act already, that a spouse is a husband or wife.
The definition of the household and recognize polygamy in that sense, and say in case of polygamy, every other is a household on its own. Because otherwise you are going to have a problem.
The Health Ministry defended the regulation, saying the Act is superior, but the aim of the SHIF is to create equity across beneficiaries and ensure every Kenyan enjoys the medical premium.
If you look at when you have a second household, you still pay school fees. The reason is services are pegged on the contributions that we receive. So the benefits can only be in line with the contributions.
Is that within that act there is a provision for an extra spouse to pay as an extra household. That is already what is in the act. Now, the how of doing it is what we are discussing this morning.
A person with 2 or 3 wives has only 1 household. In fact, Chair,
lawmakers also raised concerns over immediate removal of a spouse from the cover and want the period extended to cater for situations where a spouse is expectant.
I was thinking this spouse you had covered and you want to change the spouse from your cover, we need to give him or her 3-6 months ajipange kabla atoke kwa cover. Tusiseme immediately. Kwa sababu saa zingine unakuta hata ako pregnant, umesema anatolewa immediately. So nilikuwa naona isikuwe immediately sana, ukiamua kubadilisha, wacha tupe mtu nafasi kujipanga.
The Health Ministry further presented regulations requiring Kenyans aged 25 years and above without a formal job to pay a mandatory 300 shillings to the medical cover.
The health of all country has lied in the hands of the few employed Kenyans. They are the ones who have been contributing. What we present today is a divergent from that. That then there is a contribution from all Kenyans. And that is the principle that we are basing on to call this a social health insurance.
The regulations therefore requires an adult to be in the primary parents cover until the age of 25. Stephen Leto, Citizen TV.